Hello, people. Good afternoon. Welcome to another day in the life of Journey with Kevin. Today, my topic to you is just to speak about things to do before going for your top surgery. When you're on the waiting list for the top surgery, as soon as you get a confirmation or a date for your top surgery, as a trans man, there are things that you need to do, things that you need to bear in mind. One, you have to quit smoking cigarette. If you're the type of person who smokes cigarette, you have to quit smoking at least 6 weeks before in order to help with your nipple grafting. If you're still smoking cigarette, it will lessen your chances of your nipples coming back to life. Remember about the top surgery. The top surgery is where they remove your entire breast area and remove excess fluid. It's called a contour. And I don't remember what's the other word is. So I don't remember what's the other word, but basically they remove all the extra fat, the extra flesh, the feminine features from your chest, and they remove any extra flesh that you have underneath your arm. Everything goes down, and then they use the binder to bind your chest back together. They cut your nipple to make it smaller and looking more masculine, and then they put it back on, like stitch it back on kind of vibe, so everything can heal together at the same time. So in order for the nipple graft to work, you have to quit smoking cigarette for at least 6 weeks. Alcohol, you have to cut down on the amount of alcohol that you drink. When you're on the waiting list for your top surgery, you have to cut down on the alcohol. It's best if you quit. If you can't quit, then at least cut down. Eat healthy. You have to eat healthy while you're waiting your surgery. You also have to be healthy. Get a lot of rest. At least a week or two before your surgery, you try to get as much rest as you can get as possible, because while you're in recoup, when you're in, what do you call it, when you're healing, when you're trying to recuperate and healing, you need all the energy. So you need to save energy and have it built up. You need to have a strong support system. Have friends that you can call upon and count upon while you're in recovery. If you're in Canada and in the United States, most times they send you home after your surgery, like 2 to 3 hours after your surgery, they would send you home. So make sure you have somebody to be with you at home, and you're not going to be home alone. Points to note that after your surgery, you might not be able to do things on your own for a couple of days, including shower. You might not be able to shower any at all, and if you do shower, you can't shower from the top, it's just from the lower half. So you might need help where that is concerned. You need to have a comfortable place to lay when you sleep, because not everybody wants to sleep on a bed unless you're going to be padded with pillows left and right. A lot of persons, they get a recliner chair or they use a sofa and they sleep to the corner of the sofa and pad themselves around. Sorry, my allergy is acting up. Anyways, so having a good support system. Get into the hospital. Remember, you have to be at the hospital 2 hours before your surgery so they can prep you. If there's any forms that you need to sign, you can do so in the same period. They need time to prep you with the anesthesia. If there's anything that they need to talk to you about, some doctors take longer than some, depending on the density of your top surgery. Some people have bigger body, bigger bones, more flesh. Some people's surgery may take longer than some. My surgery is gonna be 6 hours based on what the doctor told me. So by the time this video is released, I should be in recovery, because my surgery will be in a couple days, and I'm recording this video ahead of time. My fiance Natasha will release this video when I am in the recuperating phase. With my permission, I'll tell her when to post it, because I'll be recuperating and I will not be able to make videos during that time. So by the time you see this video, just pray my strength up, because by the time this video is released, I would have already done my surgery, God's willing. Yes, guys, I know a lot of persons would have put their name on the waiting list for surgery, and then they got cold feet and they chicken out and they didn't do their surgery. It's okay to chicken out because some people change their mind after a time and they don't want to be with a trans anymore. They don't want to be a trans. They don't want to go through with the old surgery. Some persons are still transgenders but they don't want to do surgeries. It's up to you to live your truth, and it's okay to change your mind because at the end of the day, it's your life. Look at a bisexual. A bisexual could say they like both sex or they like any person who comes along, male, female, or transgender, non-binary. But then next month you will see them settling down with a woman or a cisgender, and next year you will see the person settling down with a trans person. Live your truth. To each its own. So right now I'm a trans man and I only love women. And if 10 years from now my status should change, I'm still gonna love myself the way I ought to be loved. For the studs and the butches who are out there, and you have to live the life of a stud and a butch until you're able to be in the place where you can come out as a trans, it's okay. Everybody don't have the same 4 o'clock. So you have to pick your battles and choose when and what is best for you. Remember, when you're prepping for top surgery, you have to prepare your mind and body mentally and physically. Yes, you will have a lot of anxieties. Like I've been having anxieties all week. It's not anxiety where I'm feeling like I want to change my mind. Anxiety where I'm a little nervous of the whole needles and the whole operations, whatever. But the good thing is I'll be put to sleep, so I won't really know anything that's happening until they wake me up. I have done a surgery before where I was put to sleep and they wake me up back and all went well. And that was done in Jamaica. So I'm not really worried about the process. I'm just a little anxious because I am really happy that things are coming through for me. Things are coming together the way I see it. And that is where my anxiety is coming. It's like I've been waiting for this day for so long. And when Corona came, I was getting discouraged and depressed because I'm like, I'm gonna have to wait another year before I can walk around without a shirt on. I'm tired of having to dress in layers. Every time I'm going on the road, sometimes I have to strap my breast down. Sometimes I have to wear like a sport bra, then a merino, then a shirt, and a shirt. Too many layers to try and conceal my breasts, try and hide them. I don't take pictures sitting up anymore. I don't even make videos like sitting back. I'm always crouching forward. So when I crouch forward, then my breast doesn't show. Most of the time when I do my videos, if you realize, I'm always showing just my top, up this top part. I don't want my breast to be shown. Like, I don't like the idea of having breasts. I already spoke to my partner about my transition. People, transgenders, trans men, when you're going to do transition, if you have someone in your life that you love, you have to educate the person just like yourself. Let them know what is expected and what is to come. Because while you're going through the changes, your partner has to go through the changes with you too. You have to educate your partner as you educate yourself. Every knowledge that you get, you have to educate your partner too. This is the person who you so called love, or this is the person who you're dating, so you have to help them to be able to support you. In order for your partners to support you, you have to educate them. I talk to my fiance about everything in my journey. I confide in her, and I make sure she understands what it is, because the thing about my fiance, she supports me in whatever I do. Whatever I do, she supports me. The most she said to me is that, what you want? Are you sure that's what you want? Well, baby, whatever you want, you know you have my support. Just don't hurt me in the process. And I'm like, no, baby, I'm not gonna hurt you because I'm in love with you. People, a lot of times guys goes through transition, and then when they come out of transition, or when they get to a satisfactory level, they break up with their partners. I pray i pray that this doesn't be my case. I'm in love with Natasha and I want to spend the rest of my life with her, so I hope that my transition doesn't mess with the love that I have for her. You know what I mean? Because we have something really good, and I want to see it mature for the next 20 years. I want to grow old with her. She has not seen this video yet, and she will not see it yet. I'm just gonna give her access to my YouTube channel, so when I'm off on my surgery recuperating, then she will have access to this video to upload it with my permission. So yes, I really love her. and I want to spend the rest of my life with her, regardless of what people think, regardless of what people might say or how people feel. I know how I feel in my heart. I really love this girl. Like, she's been with me at my worst, and now that things are coming through for me and for us, you have no idea. It's like there's a saying, a lot of times we spend so much time with the wrong person, doing so many things with the wrong person. Can you imagine what we can do when we're with the right person? Exactly. So now that I'm with her, I'm gonna give her my all. I'm gonna give her my best. And where she accepts me for the man I am, life is gonna be better. So people, I say this because I want you to put yourself in my shoes. You don't want to keep secrets from your partners. You don't want your partners to keep secrets from you. If you have the slightest amount of feeling that you might be a transgender, it's best to tell your partners from early out. Whatever way you can explain it to them. I used to tell my exes that I feel like a man trapped inside of a woman's body. I used to stick out for my male pronouns and my male adjectives when I go out, when I'm around my friends. I say this to say you don't want your girlfriends to be thinking that you're a girl and treating you like a girl when you don't feel like one. It's best for people to see you for who you are. So if you're with a girlfriend and you are a trans, it's best for your girl to know you're a trans. But if you're in Jamaica and you're in the closet, then your girlfriend will cover for you. But you need to have your girlfriend on your team, because you don't want to be a trans and she thinks she's with a woman when she's actually with a man. You're deceiving her. So as soon as you can let her know that that is who you are, I'm making a video. As soon as you can let her know that that is who you are, then it's better for you and it's better for her. It's better for everybody, because you want to live your truth as much as possible. If you can't live it in the open, at least live it among the people who are in your circle. All my friends knew I was a trans before I even knew. I remember one of my friends said to me, "You know you're a trans." I'm like, "I don't think so. That's not my definition. All I know is that I'm a man trapped inside of a woman's body." And he was saying to me, "That's the definition of a trans." So I'm like, okay, I'm gonna have to research it somewhere. The reason why I never believed him is because a lot of persons used to talk about the transsexual and the transgender. Because I never was interested in doing the surgeries earlier out. 3, 4, 5 years ago, I never interested in doing the surgeries, but I knew that I was very masculine. After my last breakup, I'm like, I leave